recording. That'd be great. And then just so people know in advance, we will be sharing the slides afterwards via email. And yeah, it's fantastic to welcome you all today to this webinar, looking at how we can inspire more young people to work in the NHS, but not only inspire them, but support them on that journey into the NHS, to create really strong pathways into employment for people regardless of background. And excitingly today, we're doing a joint workshop with the Careers and Enterprise Company. So I'll start off by introducing myself. So for those of you that don't know, the Health Anchors Learning Network, or HALN as we call ourselves, is a free UK-wide network for people who are embedding anchor approaches in their organisation. So really thinking about how they leverage their organisation's role as a local anchor institution to promote positive social and economic development in the communities in which they serve. We're funded by the Health Foundation, and we run a range of webinars. We publish case studies and learning resources. And if you haven't already signed up to our newsletter, do sign up, because that's the best way of keeping in the loop with the events and programs that we're running. I think Amelia's going to drop a link to our newsletter in the chat. We'll hear more from them in a second about the work they do, but just to introduce themselves. So our co-hosts for this webinar are the Careers and Enterprise Company. So for those of you that don't know, they are the national body for careers education in England, supporting schools and colleges to deliver modern 21st century careers education. And their mission is to help every young person find their best next step. So they are the dream partner for this webinar, and we're really excited to be working with them to showcase some of the findings from their work in the health and care space. I'm going to stop now, and I'm going to hand over to my colleague Izzy from the Careers Enterprise Company, who's going to introduce herself and say a bit more about the work that they do before digging into some of the insights and talking about the plan for the day. So Izzy, over to you.
Thank you so much, Ollie. That was the absolutely stellar intro, and thank you everyone for joining today's session. It was brilliant to see so many colleagues joining, introducing yourselves in the chat, and recognising a few actually from who are members of our Health and Care Advisory Group. So a warm welcome, especially to those colleagues that we are working very, very closely with, and hopefully I will do you justice in sharing the insights from that group. But lovely to meet you all. My name's Izzy Plant. I am a Business and Skills Senior Manager at the Careers and Enterprise Company. Ollie did a fantastic job at introducing us. I'm going to share my screen. I will do a very whistle-stop intro of the Careers Enterprise Company and who we are, but really I want to share some juicy data insights and reflections from lots of our work about inspiring young people into the health and care sector. And then I will be handing over to, I introduce her as our VIP guest of today, but Louisa Clark, who is giving me eyebrows for that intro, but Louisa Clark, who is the School Engagement Lead for Buckinghamshire Healthcare NHS Trust. So without further ado, let me share my screen. And I know that lots of you will be used to some of the delights of mastering Zoom versus Teams. So let's get this up. Hopefully you can see my slides. So today's focus is all about unlocking careers in health and inspiring young people to work in the NHS and the sector more broadly. Very much as a whistle-stop introduction, as Ollie says, the Careers and Enterprise Company is the national body for careers education across England. We're actually 10 years old, so we were set up by government in 2015. We are funded by the Department for Education. And as Ollie mentioned, our entire reason for being, our mission is to ensure that every young person, no matter their background, no matter their postcode, no matter which part of England that they have grown up, they all are able to find their best next step when they move from education into the world of work. So they all feel inspired, empowered, and informed about that next step. We could not do that. We could not bridge education and employment without working in partnership with organisations, employers, and especially through our fantastic local network of 44 careers hubs. And I think I also spotted in the chat when people made introductions that we do have some colleagues from our local careers hubs too representing us today. Our focus today is all about inspiring young people into health and care as a sector, and thinking about why it's really important to start that inspiration early. So today I'll share, I promised some juicy data insights. So we're actually going to pull that data from Youth Voice. In particular, we have the luxury at the Careers and Enterprise Company of having some really phenomenal data sets. I'm going to share some insights from our Future Skills questionnaire, which captures the voice of actually 1/3 of 1,000,000 young people this year about their confidence, their interests, the careers that they want to go into. And then I'm going to hand over to Louisa Clark, who will bring lots of this work to life from the Buckinghamshire perspective. So, why this matters. I feel like I don't want to spend too long on this because colleagues on the call today, you are much closer to this work than I am, and so I know you will all be aware that the 10-year workforce plan really looks at how can we ensure that we're getting the right people into the right roles in the right places, and we feel that it is absolutely crucial that outreach and inspiration of young people starts early in order to meet that expectation. And so that's why we feel like this work really matters. We're really keen to partner with employers across health and social care to really influence and make that case mandate for why working with young people earlier helps to ensure that you get a skilled workforce that reflects your local community on your doorstep, and that it's meeting some of the strategic shifts that we know is important for the sector going forward. For example, that shift from hospital to community, and making sure that young people coming into those roles are really equipped to understand the skills that they need to thrive there. So that's a little bit of a zoomed out picture of the context, but I wanted to spend most of my kind of introduction today zooming in on some of those data insights from our Future Skills questionnaire. As I mentioned, we have an unprecedented data set this year. So we have over 330,000 young people who have submitted for us as part of that survey their reflections on the local labour market, their awareness of pathways, their awareness of sectors, their interest in particular sectors, and their plans for the future. And this is one of the largest Youth Voice data sets nationally, and there's some particularly interesting insights that we're able to zoom in on for health and social care in particular. So there's lots of text on this slide, but we are going to share lots of these insights going forward as part of the follow-up from today. And you'll notice that at the top it says it's confidential data because it is hot off the press. This actually has been published today. So you're kind of getting the first look at lots of these insights. But the first headline that I would share is that interest amongst young people in health and social care remains strong. Around 20% of year 11s are interested in a career in the sector. And this is actually one of the top 3 sectors for young people at that age range. So it is popular, there's lots of interest. This is really positive. But one thing when we kind of drill down into the data a little bit more is when we consider the current workforce need and having the right skills in the right places, there are gaps that persist. So engagement varies by region. You'll see on the left-hand side of this slide that the engagement is highest in particular areas like London, the West Midlands, but that it's lower in areas such as the North East. So it is different across the country. And it also varies by gender. So female students show significantly greater interest than male students, which again might be interesting when we're thinking about particular roles, particular skills and role models. Interestingly, young people interested in health and social care careers tend to outperform their peers across all of the 8 essential skills. So you can see that again on the left-hand side. They are particularly strong in leadership and teamwork, which I guess are particularly key skills for the sector. So that is positive, really pleasing to see. But they're also, our analysis shows that they have a stronger understanding of A levels, T levels, vocational routes such as BTECs, but slightly less awareness of in comparison to their peers of apprenticeship pathways. So overall, this highlights that we have a motivated and skilled group of young people who are really interested in the sector, but there is need to ensure that all learners across England are pointed to areas where there are opportunities and the pathways to help them get in and harness those opportunities. I'm going to spend a few moments talking about why the sector should engage and start early before handing over to Louisa to bring this all to life. But I guess very simply, why should employers and organisations across health and social care engage with young people earlier? Simply because it works. So we see through our employer standards data set. So I mentioned we've got a number of data sets that we can draw on. We have really fantastic data set that captures employer voice. And 87% of employers tell us that when they engage through our support, so through their local careers hub, they are positively encouraging young people to take up careers in their sector. So they're seeing that return on investment. We know that there's obviously huge shifts in the 10-year workforce plan to help build an NHS fit for the future. And if we want to make sure that that workforce represents the local area and the local community, it's really important to think about how we can make sure that those connections between NHS employers or health and social care and sector employers on their doorstep are really connecting in to education and the young people that you have as a kind of pipeline through to those opportunities. This is kind of big context for why we worked as the Careers and Enterprise Company to think about how we could, I guess, harness and pull together the best practice from lots of health and social care partners who are working really closely on the ground with their local education partners, with their local careers hubs. We wanted to glean all of their insights, all of the things that work, kind of bottle up the ingredients of when they engage, when they start early, what makes the difference, and also where there's opportunities to go further and to learn from each other. And that is why we brought together a health and care sector advisory group. This group actually now represents almost 20 NHS trusts and integrated care boards. They are all sharing their insights about what works, ensuring that the career system on their local doorstep meets their needs and their future workforce needs. And in the past year, so we set this group up, it was kind of last October, so it's almost a year old. They've been working really closely to collaborate with their local partners to push forward their work and impact in three particular areas, I guess three particular themes. And those themes are using workplace experiences to deepen young people's interest in the sector. So thinking about really innovative, flexible ways to bring the workplace to life. They're also embedding careers awareness about the sector within the curriculum. So really ensuring that those subjects are relevant and young people can see the connection between what they're studying in the curriculum with those future careers. And then also empowering teachers to inform their young people about careers in the sector. So I guess influencing the influencers over a young person's decision making. I mentioned that we were bottling, I guess one of our aims of the advisory group was to bottle what works. That bottling came in the form of a report that was launched in June of this year. And as part of that report, we captured 10 lessons learned from the group. So these are common things. These are the lessons that they have seen work in action for them. They've seen deliver impact. I'm not going to spend a long time on all 10. And I know that as part of the follow-up for today, you've got a chance to kind of dive into that report. But the key ones were starting early, like it really does make a difference to engage as early as possible. Connecting through the careers hub, so thinking about your local careers hub team and using that team to help you target which schools and which colleges and which young people, which cohorts of young people that you work with. Offering meaningful workplace opportunities, both for young people, but also opening those doors for teachers and educators too, so you can really, I guess, maximise a lot of that awareness raising across that workforce too. Speaking of influencing influencers, engaging parents and carers is one of those key lessons learned. And then probably not surprising for any colleagues joining today, measuring and evaluating that impact. So listening and learning from young people, from parents and carers, from teachers, from all those stakeholders that you've engaged with, from your own teams that are involved with that outreach, to see how you can improve, and also what's working, so you can make that business case internally about why that outreach matters. The whole focus of today is leading by example as a local anchor employer. So I won't spend long on there at all, but that came through really strongly as a lesson learned, to kind of see this work as part of your local anchor work too. And then finally thinking about how to, as best as possible, and turn that outreach into intake. So either removing barriers to apprenticeship uptake where relevant, where appropriate, where there are those pathways available, but also preparing young people for application processes so they can make a successful transition from education into those roles that they've been inspired to pursue. And then finally, you can see the 10th lesson learned is working with us. We are still all ears open. We're very, very keen to hear about the best practice that's happening locally, what's working for you. And so I'm excited about the rest of the session today, because I know that we're going to capture lots of your insights as well. So I'm going to stop sharing my screen. Those are my headlines. Thank you for listening to my data updates. And we've got a Mentimeter to capture some of those insights, which my colleague Rose is going to take us through.
A very swift swivel of the screen that you will have just seen there. Thank you, Izzy. And just before I hand over to Louisa to hear about kind of how this is working on the ground and the impact of that, I did just want to gather a little bit of insight from you guys and really get the conversation going. I have 2 Mentimeter questions that are in the that are visible right now, and I will just pop into the chat the link to this Mentimeter. You can also see the joining code up at the top here. If you're not able to access this, please do just pop your answers in the comments, and we can make sure that we're collecting them all there. The first question is, what barriers do you face in engaging with young people in your community? And it's really around if you are engaging with young people in your community, if that is something that is happening, what barriers do you face? That might be that your organisation doesn't quite prioritise it, or that you don't have the capacity to do that at the moment and it's not something you're able to do. It might be that you don't know which types of young people to connect to, so you're not quite sure where to start, or it might be that you don't know how to connect into local schools, and you have all the wants in the world, but you're not able to do it. So I will pop the link in the chat right now, but please do sorry, this is not sharing anymore. I'll stop sharing while I do that, but please do try and get onto the Mentimeter if you can, or pop your answers in the chat. There we go. Amazing. So yeah, of course, vacancy freezes. It's something we've been really live to, and you will see when you get the report coming through in the kind of follow-up comms from this, that something that we really laid on with the group at the start of this work, which was over a year ago, was about the massive vacancies that are being faced across the health and social care system. Of course, in the old workforce plan, there was a focus on kind of filling some of these gaps, and there were some really quite large, scary numbers. Now that there is this kind of reorientation of the health service and thinking about how do we get the right people into the right places. So it's something we're staying really live to in terms of what actual skills do young people need, and in what regions do they need them. Time, of course, is another one, and it's whether this is encouraging or not, I don't know, but it's something that we hear from every sector. So we are always working to think about how can we do this efficiently, and it's exactly why we've made this kind of national ambition, so that we can kind of collectivize our efforts, and the sum of that is always better than than lots of separate parts. We're able to share best practice, we're able to scale things efficiently, and you kind of create resource out of almost nothing sometimes. Coordinating with schools, it's always difficult, and especially it can be that you might have built a brilliant relationship with a school, and maybe the person you had a relationship with has left the region in a different school, and that you kind of lose these relationships. What we do know is that long-term relationships have the strongest impact, and kind of working through local partners such as a careers hub, which we will share more information about, they are able to kind of coordinate these long-term relationships and make sure that you're able to connect in a way that's best use of your time. I will move on to the next question in a second. Thank you so much for all of your input. We will be kind of collecting all of these and making sure that we're answering them, and we can always hopefully come back to some of them at the end, and we do have chance for a Q&A as well. The next question is, what regional partners do you work with to inspire young people about careers opportunities in your organisation? So if you are doing outreach, are you doing that on your own? Is it something that you just do within your organisation, or do you work with other employers, or do you work with a careers hub or your local an enterprise partnership? Do you work with the combined authority? Who is it that is you kind of relying on? And I guess really important today when we're talking about anchor institutions and how we can connect together to speak about things like career opportunities, but also the effect that can have on a young people in a broader sense. It doesn't always have to be about work experience. It can be about, building these long-term relationships that have massive effects in terms of reducing things like health inequalities and really engaging the community. Great to see DWP in there, to know that there's also some kind of national support that people are able to access. Great to see that ICBs and other trusts are working together. The Pledge, I know them very well. Combined authorities, brilliant. It looks like there's lots of familiar names, and I'm glad that there is some coming up. And if this is something that you have been struggling with and you haven't been able to make these partnerships to really forge these connections, it's exactly why we're here today. And we'll have all the information at the end about how you can kind of reach out to find out more about these areas of support. I am going to stop sharing now and hand over to the main event, really, which is Louisa and Buckinghamshire, not to scare her too much, but really pleasure to introduce Louisa, who's been working with us really closely, not just over the past year on the Health and Care Advisory Group, but working really closely across our network for a number of years now. So I will pass over to Louisa. You're on mute, Louisa. Always the way.
Oh, that's better. Sorry, I was just saying apologies. I'm a bit croaky today, so bear with me. Yes, so I'm Louisa Clark. I'm the Schools Engagement Lead for Buckinghamshire Healthcare NHS Trust. Before I worked for the NHS, though, I worked for Buckinghamshire Skills Hub, which is the organisation that carries out the programs of the Careers and Enterprise Company locally. So I feel as I've got an extra long partnership with the CEC through Buck Skills Hub, which is really sort of set the foundation up for what I'm going to share with you today. So if someone can give me a nod, it should be working.
Yeah, that's all working.
Excellent, thank you. So I'm going to share with you I'm really going to put into practice what Izzy and Rose have been talking about today. So there'll be lots of joint themes here. We're going to be talking about how we need to reprioritise workforce objectives going forwards as a organisation across the whole country, and also then share with you what we're doing locally. I absolutely do not claim to be the only person working in this field. I'm sure lots and lots of you today are carrying out brilliant work, and I would love to hear from you all afterwards what your ideas are and learn from you too. So I'm sure we've all read the 10-year health plan cover to cover. Throughout the 10-year plan, it talks about the NHS being an anchor institution. And I think it's maybe the first time that it's been that explicit that across the whole of the organisation, this is what's expected of us. So we're really meant to be supporting those wider societal and economic goals. It talks about catalysing growth and economic prosperity for the communities we serve. And it talks about reorientating the focus of NHS recruitment towards our own communities rather than reaching out internationally as we've done previously. It's also talking about creating a workforce that's more empowered, flexible, fulfilled, but acknowledging that there aren't going to be as many of us around. So therefore, how do we get the right people into the right jobs going forwards? And really, I think it's not about just expecting them to walk through the door. We all need to do the work beforehand to ensure we get those, we get that interest. There are 3 publications that I think probably most of you have seen already, but I just highlight these because I think it's really useful. If anyone says, why are you doing this? Not only can you point to fit for the future, but you can also say that there's a really strong business case behind any kind of pre-employment engagement that you do. So there's the Health Matters on the .gov website. There's the Institute for Health Equities, building opportunity and talking about local inclusive recruitment. And then there's the Health Foundation's Building Healthier Communities. So they're all really worth a read. So moving on to sort of the practicalities, which is usually the thing I like to leap ahead to. Who are we? So Buckinghamshire Healthcare NHS Trust, or BHT, is both an acute and a community trust. And I think that actually works to our benefit in terms of how we link up across many, many different ways. But certainly from a working with young people point of view, and with that emphasis on the shift from hospital to community, we're able to show young people where those job opportunities are in the community and sort of flag that this is where things are going. So I have over 7,000 colleagues. We're probably a sort of, I would imagine, a mid-sized trust. And we have 2 main acute hospitals, 5 community hospitals, all sorts of community clinics, teams of district nurses, school nurses, a shopping centre on the high street, a unit in one of the shopping centres. So lots of different areas. Where are we? For those of you who don't know, this is us in the middle down here, nice and landlocked. We work closely with Buckinghamshire Council. I can see lots of you have already said about working with your local authority already. And for us, it's extra important because it helps us identify those areas of disadvantage where we can provide additional support. So while I'm there to support secondary schools across the area, it's really important that I think we provide that extra support. And we know that there are 14 wards across Aylesbury, Chesham and High Wycombe, where there are local communities who've been identified as being in as having the most hardship. So that's where we do provide extra support. So who are we? What do we do? Well, Bright Futures at BHT came about 3 years ago. It is myself and one other colleague, Sarah, who is 3 days a week. So it's 1.6 full-time equivalent people. So we're only small, but we have the privileged position of being dedicated to working with schools and young people. So I do have colleagues who work on our T-level placements and separately with apprenticeships, but my focus is specifically on secondary schools. We have 2 key aims. So we're here to build a diverse and skilled local talent pipeline, and really to focus on that really broad range of careers, not just everybody wants to be a doctor or a nurse. Secondly, we're here to promote the awareness of all the economic opportunities we offer as an anchor employer. So we're really about removing barriers to employment, narrowing health inequalities, and also that maybe less directly, but certainly indirectly creating healthier communities. But what is it we actually do? We run work experience, we run outreach activities across schools and colleges, and we also organise what we call insight events, so based at the trust, bringing people on board. And I'm going to give you a whistle-stop tour of some of those. Work experience. I'm sure lots of you are doing work experience already. We've chosen to concentrate on sixth formers. We may manage to expand a little bit down the line, but at the moment capacity means we concentrate on sixth formers. But it's offered across a really wide range of roles, acute and community, as I was saying. Usually it's for a couple of days, so it's a small taste just to let students see for themselves whether they think it's right for them or not. We also offer everybody a one-to-one careers advice and guidance conversation if that's helpful for them. The most important thing about our system, which we restarted completely after COVID, because it had tailed off completely and was quite out of date, also just focused on medicine. The most important thing is that it's transparent and accessible. So we work really closely with local schools and colleges to publicise how young people can apply for work experience. We do ask for widening participation criteria. So we know those students who are living in Opportunity Bucks postcodes, we can rise to the top of the queue. And if they have additional things like pupil premium or maybe they're care experienced, we also know who they are and we can provide that additional support. But we also aim to be as broad and inclusive as possible. We've split it into 3 intakes a year to help us manage it and also to not disadvantage the young people who apply later on in the year and who don't realise that what was possible until later on in the year. I say young people, we also, although it's sixth formers, I should also say importantly that we offer work experience to undergraduates and also to a small percentage of adult career changes as well, so we can facilitate that across the range. Not only do we do one-to-one experience, but then we widen it with groups, group experiences as well. Our clinical skills and simulation team are our best friends. They manage to bring all sorts alive for us, and we wouldn't be able to do half the things we do without their inspiration and input and let young people actually have a go. We also have a 3-day allied health professions taster experience, so we can highlight those in-demand unseen roles that we know we all need, such as podiatry, etc. Evaluation, really, really important. Every year, at the end of each academic year, we have a look back and see what we've done. We have around just under 600 placements a year. 1 in 4 of those last year went to students living in opportunity areas. And we can see that 97% said that they'd consider working for us in the future, which is absolutely fantastic. And we love the fact that they say that. We want to make sure that they're career ready, and the vast majority of them tell us that the work experience that they've undergone gave them a really good understanding of the skills and values we need in healthcare, and 9 out of 10 say that they feel better able to make decisions about their future career, which is obviously a huge win. We also know how they feel after their work experience. 50% of them say that it's confirmed their career choice. That's brilliant. But I think the fact that 48% of them last year also said that it opened their eyes to options they hadn't considered is really, really important. And also that 2% who say, actually, it wasn't for me, then that's a win too, because it's really important for our retention that we get the right people in the right jobs, and it's good for them too, obviously. This is just to show you that this is our medicine work experience. This is allied health professions, and these are all the others. So we really do try and widen out the range that we can offer young people. Just a quick glimpse of lots of smiley faces across lots of different areas. I always love seeing these just because it really shows you what an impact it has. Outreach activities. And we know that doing sixth form work experience alone is not enough. We have to start early, and we try and do as much as possible as we can from year 7 onwards. So we've got a really diverse range of programs. The program is really diverse, so we do all sorts of different things. So we, for instance, support the National Step into the NHS competition locally. We do 350 NHS careers assemblies. We've just started, which has been really popular this term, a developing yourself outside the classroom 1-hour workshop for sixth formers. And that's, as I say, that's really supporting the UCAS question 3 element, but wider as well, whether it's apprenticeship or going straight into work. We couldn't do any of this without our careers ambassadors. We wouldn't, although we're only 1.6 people, a lot of what we do is coordinate other people. And of course, we're also widening the perspectives and just introducing fantastic diverse role models to young people. So last year we did around 80 outreach activities alone, thanks to the support of our careers ambassadors. And I think it really does help to have us as a central coordinating function, because without that, people just don't know where to go. So as you'd imagine, we did lots of careers fairs, assemblies, class talks, but we also do employer networking, mock interviews, careers in the curriculum. We also aim to widen participation as well. That's a big part of what we do. So for those schools where we know there are more than 40% of students who live in Opportunity Bucks areas, we offer them what we call high engagement activities. So obviously we can't get colleagues out into schools all the time because they've got jobs to do, but they are the most brilliant educators and able to inspire. This is Jamie, she's the matron for cardiology and one of our biggest flag wavers, and get her in front of young people it is an absolute joy and a privilege to watch. Again, we carry on with the evaluation. So we know that after we do one of those higher engagement activities, we do ask them what they think afterwards. And it's it's always really illuminating as to what they take away from it. I like this quote: "When we got involved, it made me understand the jobs more." And that's what we try and include all the time to make it as interactive as possible. Again, just a few photos, but you can see here how many people there are helping with this. Sorry, excuse me 1 minute. I'm sorry, I can't find the mute button. Thirdly, careers insight activities. We do all sorts of other things as well. So for instance, our Discover Careers talks, which are for students from years 7 and above, and our teacher encounter program as well, which I'll talk about in a minute. We also have our sorry, I'm going to have to.
Louisa, you're doing a heroic job with that croaky voice. So congratulations on getting so far. Take your time. Louisa did warn us that she might need to go off screen at some point to have a good cough. So yes, while we have this pause, do you start thinking about any questions you might have for Louisa, or questions that you might have for Izzy and the team at the Careers and Enterprise Company, and then add them to the chat, and then we'll come to them afterwards. How are you feeling, Louisa?
Sorry, I was afraid that would happen.
That's right.
So teacher encounters, and then the all sorts of other ones. Sorry, my voice might come back in a minute. These are some of the talks that we do across all sorts of different areas. And then these are some of the results from the Discover Careers activities that we do. So they come into our lecture theatre. We try and make them as interactive as possible. And again, we're just looking at all these different areas to try and see who needs which kind of roles within these areas, and help students understand them a lot better. Again, I think we're actually bringing students on site. So it's really helping them see who we are and get that deeper understanding of us. Teacher encounters. With the help of the CEC and Buck Skills Hub locally, we invite teachers into our different hospital sites to find out more behind the scenes about what actually happens. And again, these are always a joy to do, because you really see how teachers are getting out of the classroom. They're learning about how their curriculum is potentially used in school. So they get real examples. They meet lots of different colleagues in all sorts of different roles, and then they take that back to the classroom. And the fact that these are, maybe after parents or carers, the number one influencer in young people's lives, if we can get to teachers, then we have a really long-term effect. I'll click over that. So I think that's a bit of a roundup, therefore, of all the activities that we do. I would just stress, though, that the measuring the activity and the impact of what we do is really important. So we reached out to all careers leaders earlier this year just to see about 2 years on into our new programme what we were doing and what they thought about it. And we were staggered at the results, actually. The vast majority of them actually said that they're increasing the promotion of NHS careers to their students, that more students are considering NHS careers now as a result of our programme, and more students are aware of employment opportunities locally. Really crucially, they said that their students were now starting to think beyond doctor and nurse and be aware of those wider roles, both clinical and non-clinical. So that was really important for us too. An area that we need to improve on, that's flagged for this year, is tracking destination data. It does take quite a lot of intense follow-up, but we can really see, so from the previous year, where students are actually going. So we can see that the fact that, we have that in that particular year, we did have 6 students who were specifically went to university to do diagnostic radiography, for instance. And also pharmacy was another area that we were really focusing on. And also we employed people directly as well. And that's gone on to increase more and more. So we get lots of lovely feedback. I think the facts and figures are important, but also hearing from students directly, just their voice. I mean, bless Nazir, if I did not get this opportunity, I would be completely clueless. He was actually one of the ones who went on to, he's now at university doing radiography. So good on him. Quick suggestions, I'll rattle through these. If you can have a dedicated programme in place, then that really helps. I do think it needs at least one person in each trust who's got that responsibility for engaging with schools. That means convincing senior leaders that you're needed. And I think that's where working with the CEC, working to employer standards, having the work experience quality standard, and showing the results, importantly, of what you're doing is really important. Get everyone on board. As I was saying, if you don't have those senior leaders on board, it won't happen. They really need to see, they need to understand the business case that we outlined at the beginning, and then they need to see your results. Other colleagues, if we didn't have other colleagues on board with us across the trust, again, we would be, it just wouldn't be possible. Be visible, publicise what you do internally, and you get that that real snowball effect that we've seen and that we're now starting to benefit from. So share case studies, share student feedback, track destinations, learn from best practice. Work with partners. As I said, the foundation for my role came from working for Buck Skills Hub, and if I hadn't worked for them, I wouldn't be nearly as equipped to do my job as I am today. And I still work incredibly closely with them, but also with your local authority. We work now with NHS Choices College on a supported internship programme in Bucks. We work with our local universities. We work with our local job centre. So all sorts of different things that we do. But yeah, you can't do it alone is the summary. Right, there we go. Sorry, I've gone a couple of minutes over. I'll blame my coughing.
That's absolutely fine, Louisa. Thank you so much. That was incredibly valuable and amazing to hear about all the fantastic work that you're doing in Buckinghamshire. I think 3 things that really stood out for me was, one, just the volume and breadth of work that you're able to achieve from such a small team is kind of blown my mind. I think maybe that'd be good to dig into that, thinking about how you achieve that, by making it a whole organisation mission, because 1.6 full-time equivalents isn't much, but there's clearly so much activity going on. So it'd be good to dig into that in a second. And I saw some questions related to that in the chat. The second thing that really stood out to me was that really, really proactive approach to reducing inequalities, recognising that if you don't be proactive and think about inequalities, you're just going to kind of further entrench existing inequalities. So that work around targeting your activity to priority wards and schools was really impressive. And then the third thing that really stood out to me was around how you've managed to embed evaluation throughout, and you're always reflecting on what's working, and then making improvements based on that data. So really impressive. I'm going to give you a chance to rest your voice. I'm going to direct a question first to Izzy. So Izzy, it'd be great to hear it from your perspective, looking at this nationally. How does this differ from region to region? Are most regions kind of rolling out similar programs to what Louise has described, or are there regional variations that kind of impact how people take this work forwards?
Yeah, thanks, Ollie, and definitely slightly tactical to give Louisa a little bit of time to rest her voice and get some fluids in. We do find that it varies. We do find that it varies by region. Some of the factors that I think come into play there are a little bit about the context. So whether that is it being the rurality, a coastal region, sometimes it's about access to opportunities and access to outreach. So some quite practical, but also thinking about one of the things that also stood out from Louisa sharing those fantastic impacts and kind of lots of outreach to intake stories is that sometimes it's quite difficult to do outreach that then leads to actual opportunities on your doorstep, especially if your patch has some geographical challenges around that. So we see that is definitely comes into play. It might also be dependent on growth sector interests. So young people may be more aware of opportunities that are in their local area, depending on the sectors or the particular industries that are really prominent, that are really visible, that match up with their interests. So whether that's in creative or it's in green or it obviously really varies dependent on the area, but it's trying to kind of draw those links to young people's interest. Rose, is there anything else that you'd pull out from our future skills questionnaire insights?
Yeah, I just think on the data that Izzy showed at the start, and that I will share around a link in follow-up comes, or the HALN will they'll share a link round to some of the data that we have there. But it does show that there are regional differences in interest, and that could be for a number of reasons. But what we did work out with the group is that whilst there's all of these incredible interventions that Louisa has outlined, there's almost different levers that you pull for different things. So if it is just about raising interest in the first place, and just getting young people aware that there is a health and care sector, and that there are 350 roles across that, and plus, and there's so many different opportunities there, you might do something a little bit more immersive, like what Louisa said, where you kind of have a 3-day shorter experience that you can deliver at scale. You could have cohorts of young people in at one time and just get them immersed into some of that. Whereas if it's more that that the young people are interested, really high interest in your region, but for some reason you've still got these lingering skills gaps and they're not getting into the door, is it that they need more intensive support with their assessment, and they need something like a mock assessment centre to really understand, how do I apply for a career in it? How do I understand the different pathways? So it's understanding which levers to pull at which time, and we use data to support careers hubs and employers to do that properly.
Thank you, Rose. Thank you, Izzy. That's really helpful. I'm going to ask you one more question just to give Louisa a little bit more time. It's a very specific question. Are you working with the King's Trust to understand the impact that their support programmes for young people are having?
We are. They're one of our partners, and that's a great question. And Rose, I feel like you've had the most recent conversations.
Yeah, well, one thing we're the national body for careers education, so we're funded by the Department for Education to work with every school and college and support employers to get connections into there. That's kind of our core role, and within that we know that there are lots of other organisations that work in and around us, and the King's Trust does incredible work, particularly with kind of young adults that are helping them into opportunity. So what we try to do when working with partners is make sure that there is, as much as possible, a seamless transition, so that the in-school support that young people get through things like work experience, through things like careers in the curriculum, that then can lead them to pinpoint them onto different services that other people might add. So we've been working with the King's Trust really closely on this work. They also do a lot of work in the kind of digital and tech sector, and been working with them on that as well. So yes, but as ever, I don't think you can ever get enough of partnership working, as you see on the ground with people like Louisa as well.
Amazing, thanks. Now I've just seen Josh's question come through, which is whether you've had any discussions on working with primary age children at all. And I'm going to share a link to an example I came across recently, which is a fantastic example of a trust in Northumbria that has provided scrubs, child-sized scrubs to every primary school in Northumbria to help inspire young people. And they've got scrubs covering both doctor and nurse roles, but also allied health professional roles, porter roles, so really showcasing that diverse range. So I couldn't resist sharing that example because it's such a wonderful example. Louisa, hopefully your voice has had a bit of a chance to recover. Thanks again so much for that fantastic presentation. So yes, I guess there's a question around how are you doing so much with such a small team? And I think what was clear from you said at the end around key enablers was that you've got backing across the whole organisation from colleagues from all parts of the organisation, from leadership. So I suspect that might be part of the answer. And if so, how have you gone about getting that whole organisation on board and making it a whole organisation mission?
3 years on, looking back is interesting as to how it all began. Really, I think having a few key people behind you in the first place. So the director of medical education sort of was a key supporter in early days, as was the staff engagement, leadership and leadership development teams, and I think it was. Maybe I was just a bit lucky as well to be given the freedom to actually get on and do the job. I think, as I said in the first place, actually having that understanding of local schools gave me a head start personally, which was probably a bit unfair, but that was lucky. Finding out who are like-minded people across your organization, because despite the fact that everyone is really busy, there are some people who just get it, and once you've got them on board, then you've got some great examples to showcase, and other people then think, oh, maybe I should be doing that too. Often education leads, training leads, those kind of people often are really good. I would say we try and make it as easy as possible for clinical colleagues, especially, to get on board with things maybe like mentoring work experience. So we've developed some systems which are all internal. They don't cost anything. So we work within nhs.net, and we've got MS Forms, based systems. And so my colleague and I, we do all the red tape. Would we like someone to work with us? Yes, we would. But we do all that red tape, and then we say to clinical colleagues, we want you to provide the inspiration on the day. So they don't have to worry about all those bigger questions. We also bottomed everything out to begin with. So any question, any barrier that anyone could possibly put in place, we found out all the answers to those, and that helped too. And then it really was just, again, having some senior level support, and showing, just constantly talking. So many times I'm bored of hearing myself say, we're not nice. We're not nice to have, we're not fluffy, we're not doing it because some small child would like to find out about being a doctor. We're doing this to provide our own workforce in the future and to create healthy communities. So I think as soon as you can show how you're actively supporting those two missions, then that helps.
Thank you, Louisa. And related to that is a question around how you go about encouraging colleagues to become ambassadors. And I think someone asked, do you run keep warm or update sessions with the ambassadors once they've been recruited?
It would be nice to do more of those. I think we say thank you an awful lot. I'm always taking photos. And so I work closely with our comms team. And so we do quite a lot of social media and feedback in our staff newsletters, and just show what an amazing impact they have. If there's any little gem that a young person sends in, we'll forward that on to say, look what an impact you had. And so that's why the evaluation is important as well, not just to prove your business case, but also to say thank you and to show that impact as well. And people spread the word around. And I would say 3 years on, it's becoming the norm to do this now. Whereas in the early days, it was we can't do that. And it was either they can't come here, surely that's not allowed, or I don't have the time, or that's not part of my job, very understandably. But when you can make it as easy as possible for people, when you can do that coordination role and take that off them, and as I say, when they actually see the impact that they're having for themselves, people get it.
Thank you, Louisa. That's really, really helpful answer. And I'm seeing that lots of people are using the chat to share resources, which is great. So thank you. We're crowdsourcing ideas, so it's great to see. I'm very mindful of time. Rose, do you want to take 1 minute to quickly talk about what's next from a careers and enterprise company perspective?
Yes, definitely. 1 minute will be very easy. We will have some follow-up comms coming with access to the report that the group have done, and also some of the data that we have shared today. The group is growing, and what's seen in that report is kind of, it's incredible, but there's definitely more. We've been amazed by the interest that we've had in this, and I think that really is because there is such good work going on in every single region, and sharing that nationally is the most effective way to kind of get that out there and make sure that it's easier for everyone around. So if you do want to reach out to us, there will be an email address kind of going out in that as well, that you can reach out and find out how you might want to get involved. Also kind of just thinking about this within the context of the 10-year workforce plan that's upcoming, careers and kind of early outreach isn't currently centred in that, and that is something that we're kind of trying to work with the department on, making sure that this is continuously and reprioritised in that, because there's no point in having a long-term plan that doesn't have a long-term view. So that's what we're looking to do. But yes, do reach out if you have any questions or any information at all that might be helpful. Thanks, Ollie.
Thank you, Rose. So last things from me, just to a bit of a plug for some upcoming HALN things. So we have intentionally, because we knew this webinar was coming and we wanted to kind of contribute to the discussion around it, we have just this morning published a case study looking at how Northumbria Healthcare NHS Foundation Trust is leveraging the power of apprenticeships to connect more young people with good work. And the focus on that is really around how they redesigned their apprenticeship program to be more accessible. They prepared a business case, which was approved to pay many more of their apprenticeships a real living wage. And they're doing amazing targeted outreach. So do take a look at that. It really complements a lot of the work that Louisa was talking about. And then the final plug for me is we run occasional anchor exchanges at HALN, and our next one is going to be on the Thursday, 27th of November. So this is a relaxed, informal peer learning space where you can come together with other people that might be working on similar challenges. We usually get lots of workforce people coming along, so it's a chance to connect with other peers who might be facing similar challenges and might have solutions, or it's just a place to come and vent. So do sign up to that if you're interested. I think Amelia's going to drop a link in the chat for anyone interested. And then the final thing is we really value people's feedback on these events. So I think Amelia is going to drop a link for a job form evaluation form. There's only about 5 questions. We're very grateful for any feedback you're able to give us. And then the final thing is to say a massive thank you to our speakers, Rose, Izzy, and Louisa. You've been fantastic. And thank you, everyone, for your contributions in the chat. It's been a really fascinating discussion. I've learned a lot today. So yes, thank you, and enjoy the rest of your days.
Thanks, everyone.
Thank you.